Welcome back to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about home-based care. We've learned about home health care and palliative care, and next, Jeanne Goubert is going to teach us about hospice care. Welcome to the show, Jeanne.
Thank you. Good morning.
Thanks for coming out. So we're talking about home-based care. We're thinking about the different types, and we talked first about home health care, which has sort of a focus on a transition. It's expected to be a certain amount of time, maybe after a hospital stay or some other incident that is leading a doctor to prescribe that temporary period of care that we're going to be in the home providing nursing or therapy. And then palliative care, I was really kind of fascinated to learn is very transitional, and it is a recognition that someone may be in a terminal illness for a long period of time and need home care or clinic-based care. But then hospice is a whole different area of home-based care, and it can sometimes be in a facility as well, but primarily home-based. And so tell us a little bit about what hospice care really is.
Sure. So what hospice care is a focus on symptom management. Treating the patient's physical, emotional, spiritual needs, ideally in the home setting, where they can be surrounded by family and loved ones rather than in and out of the hospital. So the focus is less on curative medicine and aggressive treatments and more on symptom management.
Okay. So people who qualify for hospice care, you have to meet certain markers in order to get into hospice care.
Yes. One of the qualifications to be eligible for hospice is you have a disease process that the doctor feels if you were to allow it to run its natural course without aggressive interventions, that it would be possible for a patient to have a life expectancy of 6 months or less.
Okay, so hospice is very focused on that end of life period of time. So with that terminal illness that we talked about in palliative care, you may have months or years sometimes that you are in that awareness and treatment of your terminal illness. And so palliative can help you to make the most out of the time that you have. And then near the end, you can transition from palliative into hospice.
Correct.
To have the quality of life that you want in those last months, and the hospice team is going to help with that.
That's correct.
So there are some differences in the type of care that's available in home health or palliative and hospice.
Yeah.
Let's talk a little bit about what kind of care you can have in hospice care.
So the big difference is the hospice team has a medical director, so you're not going back and forth to multiple doctor's appointments to be managed. So we have a medical director that's over our department. And then under that, you would have nurses that come out to the house, similar to home health. Home health aides come out to make sure patients are getting bathed and just kind of take that stress off the family to make sure that they can have that. We also have medical social workers that are there for emotional support and also to connect families with community resources if needed. We have a chaplain on staff that is there spiritually for the patients. We are able to provide any medical equipment that a family may need to manage the patient's care at home, whether that be a hospital bed, wheelchair, oxygen, whatever would make it easy and safe to care for that patient. Also, the big thing for us, or a big difference rather, is medication. So when a patient qualifies for hospice under a certain diagnosis, any medications pertaining to their symptom management of that disease process is covered by the hospice benefit. So you would no longer need to go to the Walgreens or CVS to get those medications. And any of the diseases that are not your terminal diagnosis, the doctor can also order the prescriptions for those. So it takes away a big burden of, going to this doctor this day, this doctor this day, especially for a patient who's maybe in pain or it's really taxing and difficult. They're short of breath and it's hard to get them to and from their doctors. So the nurses are kind of the eyes and the ears for the physician.
Okay, and so someone who has qualified into hospice, you kind of mentioned that there are costs associated with the healthcare that they're faced with. So how is hospice paid for?
So hospice is paid for usually through Medicare. Medicare is 100% covers hospice. So you have a Medicare benefit. There's no charge for any of the services, the nurses, the medical equipment, all those services that I mentioned, they're all covered 100% under Medicare. So those patients will never receive a bill. Their families don't have to, worry about the bill. Those patients who have private insurance, most private insurances have a hospice benefit, and so there may be a deductible. We would run that. We would speak to the insurance companies and find that out, and relay that to the patients. But usually there's almost always no cost to the family.
That's wonderful. And so it sounds like for patients who need home-based care, if they are in end of life, life expectancy somewhere around 6 months, that hospice would be the team that would care for them, and it sounds like also their family.
Yeah, so a big focus in hospice is to provide support to the family. A lot of what we do is education, preparing the families and the patient for the progression of their disease, what can they expect, so that it's not so alarming, and we're not reacting. We're kind of learning about these things ahead of time, so that when it's happening, we can spend that time being with our loved one instead of being in a panic mode. And so social work is great. They see all the patients, all their families. One thing I forgot to mention is that we also have bereavement services. So we follow our patients' families for up to 13 months, from children all the way up to spouses. And if it's if they're needing a little bit more support, then our bereavement coordinator will reach out to the community resources for that. And so a lot of what we do is for the family.
Well, that's interesting. So in addition to providing nursing care or home health aides, whatever medical care that patient needs in that end of life period, you are also interacting with that patient's family, recognizing those psychosocial needs,
yes,
and some of the mental health issues that they may be facing. And then even after the patient passes away, your hospice team is still caring for that patient's surviving family.
Exactly.
To help them with the bereavement period, to kind of process what's happening to them and be able to kind of adjust themselves back on with life in the loss of their loved one.
Correct.
That's really special. I think, so often in our industry as a health system, we're so focused on birth and health and wellness and all of the things that happen in the arc of a long life, and we're recognizing we have it right here in our home-based services. We have home health,
yep,
palliative care, and hospice care, that recognition that there's a big component at the end of life where it's not just medical care,
right,
but it's social work, and it's the general mental state of the folks in the family who are losing a loved one.
Yeah, it's a journey. It's a patient's journey that the whole family is on. So our goal is just make sure that the patient is comfortable, has quality of life for the time that they have left, and that the family is well supported.
That is beautiful. Well, Jeanne, thank you so much for coming to talk about hospice. I think it's such an important component to the health system as a whole, and just a real benefit. Thank you.
Thank you.
You've been watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we talked today about home-based care. We examined what home health care offers in the home, as well as palliative care in the clinic and in the home, and then hospice care near the end of life in the last 6 months at home and sometimes in facilities. Thank you so much for joining us. We'll see you next time on Healthy Living.